We talked last week about the two counties in Ohio that we're particularly concerned about, and we remain concerned, kind of on alert. And that is Hamilton County and Montgomery County, Cincinnati and Dayton. In fact, I was on a call with the Vice President today and with officials at the White House, and they specifically called out those two counties. They talked about a few other areas of the country, but they had a concern about those two. And so they told us that they would give us some additional help in these two communities. We'll talk to General Harris of the Ohio National Guard in a little bit. But his guard has been out, and they're out today doing additional testing. And I know the two mayors, Mayor Cranley, Mayor Whaley, have both been involved, and the county commissioner has been involved in getting additional testing in those two communities. But I want to talk a little bit about the data that we're seeing in these two communities. And I'm going to start with Hamilton County. At the end of May and into early June, Hamilton County was holding steady at an average of 30 cases per day per 100,000 population. As of this week, the average new cases per day increased to approximately 100 cases per 100,000. So they went from 30 to 100. Now, due to the delayed diagnosis, these numbers may continue to grow for this reporting period. So we assume they're not done. By reviewing other healthcare indicators, we can see that this is not solely because of increased testing. For example, more people are visiting their doctors more often and being diagnosed with COVID-19. In 1 week's time in Hamilton County between June 15th and June 22nd, those numbers nearly doubled from 40 to 78 visits per day. Additionally, we're seeing an increase in additional utilization of other healthcare services. In Hamilton County and the surrounding southwestern Ohio region, hospital utilization by COVID-19 positive patients reached their lowest level of this epidemic during the first and second weeks of June. However, as I mentioned earlier, the number of COVID positive patients being treated in standard hospital beds, ICU beds, and on ventilators has steadily increased. In fact, in Hamilton County, the number of COVID positive patients has doubled from a low of 65 on June 11th to more than 130 this weekend. Very, very concerning. Let me turn now, go up north, a little further north to Dayton, Montgomery County. We're seeing some of these same flags when we look at Montgomery County. There's a noticeable increase in cases over the last month from an average of about 10 cases a day at the end of May to about 40 cases a day in the most recent week. The community is also experiencing early signs that more people are seeking medical care for COVID symptoms. For example, outpatient visits grew from an average of nearly 7 visits per day to 27 visits per day. For the hospitals in our west central region, the region that Dayton is in, the number of COVID positive patients in standard hospital beds, ICUs, and ventilators has also doubled since the first week of June. Doubled. COVID-specific hospital utilization is approaching levels not seen since the earlier peak of the pandemic in April. To make sure we have enough hospital and ICU beds to treat everyone who needs care, such as those who need emergency surgery or in a car crash or are suffering from a stroke, we certainly need the help of all Ohioans, especially those in Hamilton County, Montgomery County, and surrounding counties, to redouble their efforts to social distance, wear a mask in public, and follow good hand-washing protocols. And again, that is not the only reason that we are concerned. We're obviously concerned about what goes on with our hospitals, but we're concerned ultimately, the most important thing is human life and protecting people. So what we are seeing in Montgomery County, what we're seeing in Hamilton County is not good. We got an alert on, basically, and we'll talk some more about those counties in a little bit.